I rang for the nurse. She pushes the first syringe in and my whole chest just went, and I was like, oh, I don't feel very good.
Oh, God.
I don't know why she did this, but she whispered, what are you doing? We don't do that. And I say, wait a minute, what do you mean don't do that? I said, she already did. And then I started panicking because I'm like, what the hell did you just do to my transplant? Like, am I going to be okay? The surgeon who did my transplant came to see me. He said, I'm really sorry, Mrs. Murphy, but we need to send you back to the OR. Your platelets are dropping below 16,000. So I'm bleeding to death. He comes out and looks at my dad and he's like, I need you to call her family. To potentially come say goodbye.
It's kind of a murder mystery.
Yeah.
It's a little bit of a who done it.
Yeah.
Taylor, you got a new phone?
Yep.
How is it?
New.
Nice.
Yeah. Fast. Holds a charge.
Yeah. So like I get a new phone every 2 years. I guess you guys are on this kind of same planet.
Yeah.
I think it's pretty common. Most people have like the familiarity of getting a new device, getting that, like bringing your device and getting a new one.
I see where you're going.
The unboxing of a new device. Not so common to get, to upgrade your internal system. Tracy, you have had a couple of transplants.
Mm-hmm.
So I'm curious. I'm going to ask you the dumbest question I've ever asked a guest ever on the show.
Great.
Getting a new iPhone versus getting a new kidney.
Mm-hmm.
How would you compare the unboxing experience of each?
Wow. Well, I didn't unbox the kidney, but
they unboxed you and put the kidney in.
Yeah. Wow, it's a good question. I really like my iPhone, so it's a toss-up, I have to say. But no.
Do you really like your kidney?
I really like my kidney. I really like my new kidney.
Yeah.
My really new kidney is incredible. It's actually, I have normal kidney function now, which is like my creatinine function is amazing. At first, it was 1,400 when I started dialysis.
But have you seen the cameras on the new iPhone 15
yes.
Pro? Yeah.
I have the iPhone 16 Pro.
Oh shit. Okay.
Yeah.
It's legit.
Fuck.
It's legit.
There's a lot of little adjustments that you can make.
So what is
side button camera? It's really handy.
What is it? The kidney or the phone? What's better?
It's the kidney.
Oh, okay.
Absolutely
Fair,
the kidney.
But was your old kidney kind of like an old phone where like once you have it for a while, you've like tried to upgrade, you've tried to upgrade it, you've tried to make it work better because they keep on telling you like upgrade it. Have this upgrade. All the upgrades, they slow it down. The battery stops working. All of a sudden you got to charge it 3 times a day.
It's called planned obsolescence.
Yeah, I got to say, and in Tracy's case, you have had 2 kidney transplants, not 1, but 2. You have had the absolute joy of knowing what it's like to have 3 different kidneys.
Yep.
2 kidney transplants, kind of wild. And the time period between each transplant is, that is also something that kind of blows my mind. And I guess we'll get into it. But before we do, please take a moment, introduce yourself to our listeners. Give us a little insight. Who is Tracy Murphy?
So I'm Tracy Murphy. I am a 2-time kidney survivor and now a patient safety whistleblower, so to speak. I am strong into patient safety advocacy, and I'm trying to teach others how I helped prevent 8 life-threatening errors from happening to myself.
Oh, wow. Okay.
And so I'm spreading the word.
Did you say 8?
8
life-threatening errors?
Mm-hmm.
I don't know if there's a quick way to like go through those. But,
It's
I mean,
a lot.
what do you mean? But what do you mean by that? Like life-threatening errors? Like what is that?
Killed me or could have killed me.
And do you mean like mistakes?
Medical errors that happen in the hospital.
Boo-boos.
Boo-boos.
And what's interesting is like we've been doing this podcast for 10 years now. We've spoken to a number of patients. I think we've maybe had a few people tell us about mistakes that have been made in the hospital. But the thing I think that it's hard for me to like wrap my head around is like what is a mistake, and like how do you even know? Because like if I was to go into a hospital, I feel like I'm kind of naive. You put your trust in the doctors and the system. They're supposed to know what's best for you, and you assume that they're not going to be making mistakes. Like how do you find out that they've made a mistake, and what does that look like?
Well, I didn't always know. I've actually had mistakes happen to me right when I was from 5 and up. So, and didn't realize it until I got older that holy shit, this was actually a medical error or a misdiagnosis that could have gone severely bad. And actually it did end up going not so great for me. So, once you start asking questions and sort of the right questions, you can figure out if something's going on or not. And that's the whole goal of asking questions, is to help prevent the error from happening, as opposed to letting it happen and then going, oh shit, like this just happened. So that's kind of where I'm at now.
Okay.
Is that I've covered all the oh shits. Now I'm asking questions.
So you have, is it HSP?
So when I was a little girl.
HSP.
Yeah. So it's really rare. It normally happens in children between the ages of 5 and 8. And
what does it stand for, HSP?
Henoch-Schönlein Purpura. So each part kind of means something different. The Purpura part.
You sound like a alien on like Fifth Element.
I know, right?
Say it again.
Henoch-Schönlein Purpura.
It sounds like a different language.
It's like a German. It is a different language, actually.
Okay.
It's named after 2 German doctors who discovered this. Yeah.
That's like a different language.
Brian made such an insightful.
Can you say it again?
Insightful,
Henoch-Schönlein
Purpura.
Mm-hmm.
Henoch-Schönlein Purpura.
Yeah.
It sounds
I may
like
not
a
be
curse.
doing it justice
It sounds
either,
like a fucking curse.
It kind of was.
What is it?
So the way that it works is that, well, I'll explain to you how I discovered it.
A witch said it to you in her little hut, and like 7 times.
I know, right? It's actually, they think it came from a mosquito bite.
Oh, okay.
So that's one of the theories.
Okay.
Whether that's correct or not, I don't know. I don't think they really know a whole lot of information on it yet.
Like West Nile virus.
Yeah, it's like actually, yeah, it could very well be. Something along those lines, at least. I'm not sure.
Guys, you're onto something here.
Guys, how rare is this? I tried to Google it.
Yeah.
This is how badly.
Wait, how did you spell it?
This is obviously how bad I spell. I even forget what she even said. So I put HENEC. I just put I just was like Henoch. I spelt it. What's it called? No. What's the
phonetically?
Hooked on phonics. I spelled it.
How it sounds.
I spelled it hooked on phonics.
How did you spell it?
HENEC space. I'm guessing these are more than one word.
Yeah.
Yes.
3 words. Okay. HENEC SHOLENG POPURA. And my results? Nothing.
0.
It literally went, Google doesn't know.
Yeah.
Google said, and they can't even guess.
HSP.
Now it did say, did you mean Henoch-Schönlein Purpura?
Yes.
Spelled HENOCH SHOLENG. So I actually got Schönlein right, and Purpura, which
good job.
I also got right. And so I'm going to say yes, and boom, there we got it. I got it.
Perfect.
So you tell me.
Yeah. So I came downstairs. I was like 5, and I said to my mother, hey, like I have this really bad pain on the back of my legs. And she's like, it's just growing pains. It's normal. But normal ended up becoming like 3 weeks of me saying, hey, I still have this pain. And it didn't kind of go away. And so then I started crawling everywhere. And sometimes it was, this is weird. And especially for a kid, because when you ask a child like where the pain hurts and they're like, oh, it hurts here. No, it hurts here. You kind of think they're faking.
Totally.
And so that's kind of what happened.
You said you were 8 and you were crawling everywhere?
I was like 5 or 6.
Okay. And
I was crawling everywhere.
Right. Guys, I gotta show you.
You started crawling because you were in pain. And
I got to show you these photos because like
the Purpura part is
insane. How was your, like I'm looking at Google photos, so I'm assuming I'm seeing the worst of the worst of the worst.
Yep.
But like
you break out in like red, purple blotches.
Was yours like so you guys can see it here.
Yeah.
This is it's pretty gnarly.
Yeah, that's how it looks.
Whoa, yeah.
So, and that's actually when this happened, that's when people were like, okay, so something's going on. So I actually had these but it was from the waist down, right? So it causes like severe joint pain. It causes like abdominal cramping. But one of the things is that it prevented me from being able to walk properly.
I bet.
And so I started crawling everywhere, to the washroom, to school, which was like 5 blocks from my house.
What?
And so my mother took me to my family doctor, and my family doctor had said, she tested my reflexes. I don't know what that had to do with anything, but that's okay. I guess maybe neurological something or other. But so she looked at my mother and she said, she's perfectly fine. She's just crying for attention. Whoa. And so we went home and I cried.
And you obviously didn't have like the red crazy.
The Purpura
not yet.
didn't show up yet.
Not yet.
You only had the Henoch and Schönlein.
Yes, that's right.
Yeah, the Purpura was
yeah, actually it showed up on Christmas morning. So we're at my grandmother's house. We're all gathering for dinner. My cousins and I are in the living room playing, and then my grandmother calls us all to come eat dinner. And so I yelled at my mother. I'm like, I can't get up and I need to use the washroom and get to dinner. So my mother picks me up. She's super frustrated with me. And she brings me into the bathroom, pulls down my tights, lifts up my dress, and sits me down. She's like, whoa, like, what the hell is this? And that's what my legs look like.
No.
And so my aunt actually delivered me when I was a baby. So she's a nurse.
Okay.
And she was there. And so she calls in my Aunt Joan. And my aunt's like, I don't know what the hell that is, but you need to take her to Emerge right now. And so they did. And I had this like vivid dream. I don't know if it was actually real or if it was imagined. But I'm lying on a stretcher and I'm completely naked and I'm just a little girl. And there's all these doctors all around me and they're poking at me like I'm some kind of like, insect that they're, trying to figure out what the hell's wrong with me. And so I spent 6 months doing that. I could have like filled this room with finger puppets because I had so many tests done and stuff. But yeah. So
that's, for folks that don't get that reference, I don't know if that's like international, but like at the CF clinic, whenever you would go to the CF clinic, you would get a finger puppet. They had like, it was always like a really sweet old lady who like just volunteered her time and she would make all these different types of finger puppets and like they were all different characters. They were really cool. I was like,
probably the same woman who's making all the hats at the maternity ward.
Yeah, maybe. I mean, I don't think it would be the same woman.
No, it's one person. She
holy
does
shit!
everything.
Wow,
that's crazy.
The same woman that gives you popsicles too,
and they never let her stop.
It's
actually super sad.
She's in the basement.
She's the one in the basement. Going,
everyone thinks. Everyone thinks it's very sweet because
okay, so. Now is that something you kind of grow out of, or like, do you have it today, or?
Well, so the doctors told me then at that age, I don't know why I remember that, but they did tell me it was like a cold that eventually would just go away. Huh. And so I thought that was it. Like it was just like a virus.
So they did diagnose it.
They did say then that they thought I had MS first. They named all kinds of different things. And then they were like, no. They brought in these specialists and they were like, yes, it's HSP. And
it's actually previously known as Henoch-Schönlein.
They changed the name
Purpura.
recently.
It's now IgA.
Yeah.
It's now IgA. So now we know where not to be shopping. No, it's IgA vasculitis.
Yeah. So they diagnosed me with IgA nephritis once they discovered that I had kidney disease. So when you have HSP, there's a 1 in 100,000 chance that it'll attack your liver or your kidney.
Okay.
Haven't won the lottery yet, but I won this lottery apparently.
So you think that there's a direct correlation between the HSP and your kidney issues that you
as soon as I told the doctors that I had HSP as a child,
they went,
like,
oh,
okay, that's what you have.
So and just to like get this story right up until this point. So you were in like doing tests for 6 months, you got all these finger puppets.
Yes.
They eventually come to this diagnosis, but at that point when they say it's basically like a cold, is it true that for most people who get that at that age, that if, let's say, it doesn't attack your kidney or liver or whatever, that it will mostly be like a cure, a cold, and you won't experience any? Yeah.
From my understanding, that's what happened to other people.
Okay.
I did meet an adult once who had HSP, and apparently it's extremely dangerous when you're an adult. So
Yeah, it says Henoch-Schönlein Purpura can affect anyone, but it's most common in children under 10. The condition usually improves on its own, but medical care is generally needed if the disorder affects the kidneys, which, I mean, it sounds like in your case, at the time, maybe it was, but they didn't even know that it was affecting kidneys.
Check it.
Right.
Yeah. This is where the ask questions part comes in.
Sure. Yeah, right. And like, I mean, at that point, you wouldn't have been asking those questions. It would have been your mom and dad probably.
Yeah.
So yeah. Oh, right. Oh, wow. Complications, kidney damage, obviously. Also, bowel obstructions. In rare cases, Henoch-Schönlein Purpura can cause intussusception.
We know all about
that. Maybe that's what I had as an adult.
You don't even have CF, dude.
Yeah.
Why does Trikafta seem to work?
Yeah.
It's just that witch.
Okay. So, and I guess the interesting thing about this is that, and maybe this is an oversimplification, but you mentioned that 1 in 100,000 might have it attack their kidneys or liver.
Yeah.
Is it that like because the odds are so low relatively that it will do that like maybe you believe that the doctors didn't check, or can they even check at that point?
They could have.
Okay.
But I think it was a matter of maybe my mother was not aware to check because.
But your mother's not a doctor.
No, but she knew I had it. So it should have been something that they should have just kept
following up on her.
Right.
There was no follow-up.
Another little interesting tidbit here, and this is kind of this. I mean, I feel like as a new parent, or like as some like Kira and I thinking about having a kid, it's like I feel like seeing these things, I'm like, all right, I should remember this. Nearly half the people who have HSP develop it after an upper respiratory infection, such as a cold. Other triggers include chickenpox, strep throat, measles, hepatitis, certain medications, food, insect bites, which you said it could have been, and exposure to cold weather. That sounds bullshit to me. The cold weather part, it's like...
You know what, actually? A lot of people I've found that have HSP are allergic to the cold, and I'm allergic to the cold.
Oh, interesting. Okay, so maybe there's something to like, don't go outside with wet hair in the cold. You'll catch a cold, and then you'll get Henoch-Schönlein Purpura.
But it's not
Jay,
actually...
when you do have a kid, you will quickly...
I'll think they have HSP all the time.
You will quickly realize that there is way too much shit to try and remember and keep in mind.
Oh, yeah.
Because like, there's a trillion things. And especially all babies are just get like red blotches all the time. And you're like, Jesus Christ.
It's funny. I was looking through these photos and I was like, God, that kind of look like Naya. Like, did you guys... Did you guys look at HSP?
Yeah, Tilly, your daughters have had red blotches.
Every time I see them, they're like some sort of
occasionally
rash.
they just come up.
Every kid ever.
and that's normal.
The first time around, you're like, oh my God, what is happening? The second time around, you're like, that's totally normal.
Yeah, and then they grow up and have need 2 kidney transplants. So let's fast forward. Let's go all the way up to. I mean, unless there's like some stuff you want to talk about.
No.
We fast forward to the early 2000s. You started running into some kidney issues. What did that look like? I know you had your first transplant in 2011.
Yes. So
maybe give us like the sort of lead up to that.
Yeah.
What that looked like.
So I never had any like reason to think that my kidneys were not good. Everything seemed fine. I was extremely energetic when I was younger. I was a fitness instructor. I taught fitness classes as a hobby. I've had 2 children now. And when we gave birth to our first child, that's when we discovered that I had kidney disease. So the whole HSP thing came back at that point. And so I didn't know that it attacked my kidneys. So the doctors were like, no more kids. Your kidneys are completely shot. And this is actually amazing that this happened. But they told me then that like I would probably need a transplant. Like things were not good. And so I didn't like that diagnosis. So after I had my daughter, I started... This is when I became a fitness instructor. I started cooking from scratch and taking like nutrition courses. And I changed my whole perspective of life and positivity, hence the name Optimistic Kidney and my the company name that I have. And I started teaching fitness classes. So I was in excellent shape. I was doing everything right. And I turned my whole kidney function around. I was doing so well that we really wanted to have another child. And the doctors were like, you absolutely can have another child. And so...
Oh, wow. Like the doctors were like, yeah, you're killing it now.
Yeah.
Right.
So
cool.
I spent pretty much my entire pregnancy with my first child in the hospital. And then when we got pregnant for my son, the only time we went into the hospital for him was to give birth to him.
Pop him out.
Yeah.
Crazy.
Crazy. Yeah.
And so really lucky. And it wasn't until I caught the H1N1 virus that actually killed my kidney function.
So like between like there was like a sort of rapid decline in your kidney function, and then and you kind of learned about that through the birth of your daughter, and then between the birth of your daughter and the birth of your son, you were able to like lifestyle turn your function, your kidney function around.
Yeah, it made a massive difference in my life. Like especially like I started reading books on positive thinking and affirmations and the law of attraction, not from The Secret. But
I read The Secret.
Yeah, The Secret's great. It is.
I loved
There's
it.
nothing wrong with positive thinking.
I loved
it. It doesn't hurt.
That's
it
doesn't hurt.
It doesn't hurt.
Only if you know that you need to take action.
Yes.
Not just
if you're one of those ding dongs who goes, I want $1 million and writes it on a sticky note and puts it on your mirror, and then that's all you do is just look at it.
If you think about it for 5 minutes every day, though, maybe
it's gonna happen.
That's you know. Well, I mean, whatever. That's for a different podcast. But
So that really,
was there? I got a question though about this whole thing. I mean, because that's cool. That's cool that you like. So the positive like thinking is. I think it's great.
Yeah.
The and like you're going down that road of like reading sort of like self betterment through
Think and
your
Grow
mentality
Rich or whatever.
Yeah. Napoleon Hilling's great. Yeah.
But was there any?
Me too.
Was there any kind of like resources or anything you were looking at that pertained specifically to like, lifestyle and diet and kidney function or anything like that? Or was it more so just like I'm going to go like monk mode, cut out the bad stuff, just try to like live like the best life that I can based on the things that I know to be true, where it's like good diet, good physical
That's exactly
health, all that
what
stuff.
I did.
Okay, so it wasn't any like, and I heard that for kidney function I should do this, that, or the other thing. It was just literally like, I'm gonna just have a good lifestyle.
Life. That's what I did.
Right. Okay, cool, sweet. Wow. Yeah. Well, sweet. That's like very cool.
Yeah. Well, if you haven't read about like Wayne Dyer before, he's considered the father of motivation. He's written like 43 books, I think. The first book I read of his was A Spiritual Solution to Every Problem. And it just really changed my life.
Cool.
And I just kept reading more and more and more. And I could almost recite every single one of his PBS episodes because I watched them so much. And that's what they say, like when you're trying to change your life and you're doing it through like positive reading or things like that it's repetition, right?
Yeah.
It's practice.
Yeah.
I was actually on Oprah once and she told me that.
Oh, you were on Oprah?
I was on an Oprah webcast, but still,
yeah.
I had
you were on Oprah?
Yeah, it was on my bucket list to be on Oprah. And
you just thought about it every day for 5 minutes and it happened?
Yeah. No, I it was really strange actually how it all happened. But
that's crazy.
I know. Like they actually had a podcast going and not a podcast, a webcast, I guess, at that point. And so spirituality and like positive thinking, like universal spiritual energy is what, because I'm a Reiki master as well.
Okay.
So really into that kind of stuff. So when they told me they didn't tell me personally, when I saw they had this show coming up, what you could do is you could ask them a question beforehand. So I typed in my question and sent it off and wasn't thinking of the time change because they're in Chicago. And so at 10 o'clock at night, the next day, I get a call and it's some 310 area code and I'm folding towels before I go to bed. And I'm like, who the hell, except for a telemarketer, would call me at this time of night.
Yeah.
And so I'm like, I don't know, 310 area code. This is shady or sus, kids would say.
That's Oprah's preferred time of day to call.
Yes, it is. And so they were like, it was the producer. And she said, do you mind holding for Oprah? And I was like, yes. And so she's like, wait, what was your question again? And basically what I asked them was, how do you stay present? Like you read all these books, you do all these things to keep yourself motivated and present, or like positive, but how do you keep it going so that when you
easier said than done. Yeah.
And they were like, just every day you get up and you brush your teeth. It's the same thing.
Yeah, right.
It's a part of your routine.
Yeah.
It has to be.
Yeah, Jordan Peterson says, get up every day and make your bed first thing, right, guys?
Yeah.
Right, guys?
He has
who's Jordan Peterson?
He has said that. Yeah, Brian's unfamiliar.
Yeah.
Yeah, God damn it. I know someone's going to listen to that and go, I knew it. I knew he would. Anyway, so you end up. So you mentioned H1N1 now for the young kids out there, all the young kids listening that think this entire podcast is sus.
Yeah.
What is H1N1? Give them a little refresher for the thing that was like on everyone's mind, like when they were just a wee little tot.
Yeah. So it was primarily attacking people at that point. It was like a virus that was geared towards people in their 30s.
It was kind of like COVID, really. Like
it was very much so.
It was just a virus. It was like the flu.
Yep.
It didn't get the traction that
was H1N1 like bird flu? Was it?
It was pig oriented.
Right. Okay. It was some animal. It was someone pig, and that's how it started.
There was sex at some point for sure.
Which one was the bird flu though?
Someone had sex with a bird.
But there was like SARS, H1N1, COVID. I mean, they're all like different animals.
Yeah, it was also called swine flu.
Yeah, swine flu, right? Yeah, right. Bird flu. They all have the same sort of categorization of like H something,
yes, that's
one
right.
something.
Yeah.
Yeah, this is just to give you the listeners context too, especially for the young ones. This is when we were looking for weapons of mass destruction in the Middle East.
No, it was after that.
It was after shock and awe.
But like, this was more, it was the next thing to worry about.
This was more financial mortgage crisis.
Yeah.
Okay.
This was the bubble bust.
And just so everybody knows, we're all super experts on all of these the designations for flus and like where they all come from, and basically everything.
That's why people listen to this podcast.
That's right. Yeah, because Jordan Peterson does say. So H1N1 is going around.
Yes.
And you caught a good case of it.
Yeah.
All right.
So I'm super sick, and like my son was only a year old.
Right.
Actually, he was almost 2. Sorry, when this happened, and so I was so weak, and like I didn't even realize I was so sick. I stopped peeing altogether, and had no idea that I wasn't peeing. And I just remember like lying in the tub and thinking like I'm gonna die. Like I just felt that ill that. Like my skin looked almost like a scaly gray kind of color. Like I had that full on zombie look without even trying. And I remember I went to a walk-in clinic.
Like without it being Halloween.
That's right.
Without
yes, which is one of my favorite holidays. So I would love that look, but not at this specific
Didn't line
time.
up.
No, yeah. And so I go to a walk-in clinic, and this is not really a great scenario. But anyway, I go to the walk-in clinic and I tell the doctor, I have my son with me. I'm pushing him in a stroller, and I'm so weak. I don't even know how I made it to the walk-in clinic. And so I sit down in the chair. He comes in. He like squeals his little stool around, and he's like, so what's up? And I'm like, I'm a fitness instructor. I started gaining weight is what I noticed. And I'm like, I'm really sick, blah, blah, blah. Couldn't stop throwing up. And he's like, you have the flu. So he said, go home, drink lots of orange juice, and get lots of rest.
And stick your feet into bags full of curdled cheese.
Exactly.
And overnight. That's
a method. Yeah.
So he didn't take my blood pressure. I told him I had a history of kidney disease. He didn't do a thing. Well, I was not in a good situation at the time, and I had no idea how bad of a situation I was in. So the next, 3 days later, I think, I went to my family doctor, and he listened to my chest and took my blood pressure, and he was like, it sounds like you might have pneumonia. And so he's like, I want you to go get this blood work done. And I said, I took all of my energy to get in here today. I said, I really just need to go home and rest. Promise I'll go in tomorrow and get the blood work done. And so I went to the clinic, got the blood work done. And before, I had a chest x-ray too. Before I even got in the door, the hospital was blowing up my phone. And they were like, don't wait. Don't do anything. Just get the hell to the hospital right now. And so
you had the blood work, and they were like,
you're on your way home. And they're like,
you have H1N1.
Well, they didn't even tell me anything. They just said, get to the hospital, absolutely right away. And so we just bought our first house, and we were renovating, and my mother-in-law lived in the back because we had a ensuite apartment in the back. And so luckily she came home from work. And so I'm like, well, I can't leave yet. I have to make sure my kids are good first because my mom hat's on before I can put on a patient hat. And so I tell my mother-in-law, I'm like, yeah, they said go right away. And she's like, why are you still here then? So my husband comes home from work. We drive to the hospital. As soon as we get there, they put me in this room, this stretcher. And he's like, your potassium is over an 8, which means that someone in my shoes could have had a stroke or a heart attack instantly.
Wow.
And they weren't sure how I was still functioning at that point. Your kidney function, your creatinine function is supposed to be 0. That means you have good kidney function, or anything under 100 at least. Mine was at 1400.
Oh, whoa.
And so they were like, you're being admitted, and we think your kidneys are failing.
It's like rhabdo, right? Rhabdo, yeah.
It was instant.
Yeah.
Yeah. And so
this is for context for people, if you really intense athletes, say someone who runs Ironmans, running an Ironman, you can end up with rhabdo because your CK, your creatinine levels skyrocket.
Yeah.
So it can kidneys up. So somebody who runs a marathon, if you check your CK levels right after running a marathon, they're going to be really high.
Yeah.
Typically, a healthy person, it's that's kind of normal. They will come down.
Yeah.
But you can tell after a hard event, I raced provincial road race yesterday, and afterwards, it almost hurts to pee.
Yeah.
Because your pee is so heavily concentrated.
Yeah.
And it's there's a heat to it, and it kind of hurts.
That's because you might have kidney stones too. for you.
Kidney stones. Why do I have kidney stones?
You just might have them.
You just have that look.
Like you're just like, that's just
I've just been looking at you lately and I've been
just thinking kidney stones.
Yeah.
You do.
Okay.
It's a dad thing too.
Yeah. I think it's a dad thing.
All dad, man. Everyone's dad's pushed out a fucking stone.
You're probably,
you would know if you had kidney stones.
And you might have you'd be getting close to getting a hernia for sure.
Right. Because that's a dad thing too.
Yeah.
I've been working in the garage a lot.
Yeah.
So 1,400. That's high. Yeah. And that's really bad. So they didn't even give a fuck about the H1N1. They were going, dude, you're.
Yeah.
Did they know? I mean, because at this point, they probably that's not even on their list of things to give a shit about.
Yeah. Well, it was weird because they kind of put me on restrictions and then took me off restrictions, then put me back on restrictions again. So in like restrictions, I mean, like they put me in a glassed room. And in ICU, where people had to wear like booties and shoes and like the whole gowned up look, right? And anyway, I was kind of in shock. Like the whole thing was really beyond me at that point. But I was at the Dartmouth General at that point. They moved me to Halifax, and they basically told me that I was going on emergency dialysis, and so they had to push a central line in my neck, and that was it. I ended up on emergency dialysis that night, and they actually was crazy. They thought that I was having like an acute chronic kidney disease. So it was something that was like building up over time. But in this situation, it was quite dangerous where I was at. And so they put me on dialysis, and they put me on chemotherapy.
Oh, wow.
Because it was an aggressive form of... Yeah, they were trying to like jumpstart my kidneys again.
Holy shit.
So for 3 months I had to do chemo.
Whoa.
But
that's a long jumpstart.
Wait. So, I think maybe I missed it, or I don't quite understand it in the sense that
I didn't either.
So you like they know your kidneys are basically you're like basically experiencing renal failure. And did they know that you have H1N1?
Yes.
Okay.
And actually,
is H1N1 like infectious or
extremely
like, contagious?
It's the like, I mean, H1N1 is the flu.
So like when
when H1N1 happened, they were like, "Who knows? This could be a pandemic."
Right. Like it was like be in a glass box and gown up and like people. Yeah, you have hazmat suits.
I also think like relative to something like COVID, it was like. Not as many people got it, but if you got it, it was worse.
It was bad.
Because like, and I'm imagining sort of being in your shoes early on in figuring this out, where like I wouldn't know to be more worried about the renal failure or the H1N1 or like what the fuck is going on. Like, am I gonna die from this? Like, how bad is it? And I guess the question is like, what was it like trying to understand that and figure that out yourself?
It happened so quickly, and actually. It's really bizarre, but most of my situations happened in an emergency setting. So majority of the surgeries I had, all emergency, it was kind of like, oh, this is happening. So let's go to the OR or, so basically I remember lying there and thinking, people are staring at me from outside the glassed room and they're all trying to figure out what the hell is going on with me. And it was just not a good situation. To say I was in shock would be an understatement. Plus, I was so sick. Like, when you're at that point and your levels are that high, all I could taste was blood, which was very weird. All I could smell was blood. And, it was bad. And so, like, I had fluid on, but I was a fitness instructor. I weighed about 118 pounds, and I taught 3 fitness classes in a row every week as a hobby. So I was in really great shape. And it actually is what saved my life because my heart was so strong. Like I remember the nurses coming in and saying, "Oh my God, I wish I had your resting heart rate." Because it was I was in such great health, which is really what saved me ultimately. And so I just remember everything happened so quickly that I was in the room. Everyone had to like gown up to come see me. And then they said to me, "We're going to put a central line in your neck. Like you need to get dialysis done right away." And I'm so dehydrated. Like I remember them giving me saline and I was rolling around the stretcher like, "Oh my God, it burns." And they were looking at me like, "It's only saline. Like, why are you freaking out?" But I was so dehydrated that it was so bad. And so when they tried putting the stent in my neck, I was so dehydrated, they couldn't get it through my skin. So the doctor's like literally on the table, pushing all of her might down into my neck, trying to get this shunt put in.
Whoa.
And
yeah.
Yeah.
Whoa.
So, and I had this one nurse, she was so sweet. She just kept lifting this sterile towel that was around my face up, and she was like, I'm here, it's
like,
okay.
Peekaboo.
Yeah. And like,
Peekaboo.
I just was in complete
It's
shock.
not in yet.
So, yeah. So, but finally, when I got in, they did my first treatment like instantly.
Okay.
And
so what was the how long was it until you said you were getting this, like you were getting chemo for like 3 months, you were on dialysis? How long until they were like, we have to take out your kidney, we have to give you a new kidney?
Yeah. So they didn't actually take out my original kidney. I still have my native kidneys because it's a really big surgery. It's a dangerous surgery.
You have but still to this day you still have two.
Wait, how does that work?
So your kidney doesn't filter like your kidney is one big filter, right?
Yeah.
It's just thousands of little fibers, right? And so mine just didn't filter properly. The H1N1, or not H1N1, but the HSP just killed the filter.
Right.
So I was producing pee.
Right.
But it wasn't removing the toxins and like all the waste that was going through my body.
But when you got a kidney transplant, they put a new one in, but they kept the old one in?
Yep.
How does that work?
Holy shit.
I feel like I need a diagram or something.
So I still have my native kidneys.
4 kidneys.
So no, they actually had, it's part of the story. They actually had to take the kidney out. So I had my first transplant here. I had my second one here. And then your native kidneys are still in there.
For the folks listening, here and here was left and right side.
Yeah, sorry. Yes.
So let's start with the first transplant.
Yes.
They go, we got to give you a new kidney because you're just sitting on 2 lemons. They're not doing anything.
Yeah. So dialysis takes the form of a kidney for you.
Yeah.
And so it gives you an artificial kidney. And so they did the 3 months of chemo. That wasn't working. And I didn't have to go for radiation. It was a pill that they gave me.
Yeah.
And so after the 3 months, they were like, okay, we're just going to do the workup and get you a kidney transplant.
Okay.
And so my parents stepped up. My stepmother ended up being a perfect match.
Which is wild.
I know.
That is like, our friend Ellie, Ellie.
Yes.
Is still on the fight, still on the hunt. If you haven't seen it, go check out Ellie's episode. It's amazing. She's looking for a kidney. If you got an extra one, which you do, unless you're sitting right next to me, you should just give your kidney to Ellie if you could. But she's been having a hard time finding a donor. I think a lot of people have a hard time finding a donor.
Yeah.
Your donor, your first donor was your mother-in-law, which is
my stepmother.
Your stepmother.
Yes. Yeah.
Which is, same really, right?
Yeah.
Of
course.
Which is wild. Like that's wild. And so you go and you have that transplant.
Yeah.
But they go, we're just going to kind of shift one of the kidneys a little further back and put this one in front or whatever.
Yeah.
And they keep the 2 that are the dead ones in there.
Do they like unwire them?
Exactly.
Disconnect them?
So your kidney transplant actually gets connected to your bladder in the front of your stomach. And so it's not in your back. It's in the front.
Do they always keep the old one?
Yeah. Unless they're polycystic. So polycystic kidneys is typically
I had no idea.
I didn't either. I never
Yeah.
knew that.
So this is why you can't do like aggressive sports or any aggressive activities, because you have in your back, you have your rib cage to protect your kidney function. And yeah.
Oh, and then they give you, so then when they give you the new kidney, it's not in the protected area anymore.
That's right.
So we're looking at a photo of the scar, or rather,
that's my first transplant.
The fresh staples of the kidney, which is in the front, right under your belly button.
Yep.
For folks just listening, kind of wild.
Yep.
Is this a part of this? Now we're looking at another photo right now that's a little hardcore.
That's way later.
That's way later. Okay, cool.
Yeah.
Okay.
And was this a success? This first transplant?
So kidneys are a funny thing when you get a kidney transplant. Sometimes
like
they
funny or no? I'm sorry.
Yeah.
I'm done.
Maybe sometimes. So what happens is it can either, like I started peeing right away as soon as they connected me.
Nice.
But the kidney wasn't filtering as well as it should have right away.
Okay.
So, but that's not an uncommon thing.
Right.
So that's one thing a lot of people don't know is that your kidney may be in shock, like from the transition of one body to the other. And they've done things, hence my new transplant, to prevent some of those things from happening in the future. So I got the kidney put in. Everything was good, but it was just a little slow going. And so there's no rhyme or reason. So do your history on this one because, or your research on this one too, because sometimes a kidney might just start working just like that.
Sure.
And there's no rhyme or reason, no scientific knowledge to it. It just starts working.
Starts to click, yeah.
And so I was in step down a couple extra days longer than the typical person would be. And that might just be because of my history from HSP and whatever else. So I think I got the kidney May 20th, 2011. And May 27th, 2011 is when I moved from step down to the floor. So the doctor made a note in my medical chart saying that I was progressing. Things were looking really good. So they moved me that day from step down to the floor. And so, unfortunately, I only spent less than 24 hours on the floor because, and this is where things kind of get complicated. So everything was great. I was on the normal floor of 6B in the hospital, and I fell asleep for a nap. I woke up and I felt I had heartburn and pain. And so, because of the stage I was at, I was getting ready to do my own medications to be able to go home and, live my life, right? So I was only getting Tylenol now for pain medication. And so I rang for the nurse. This nurse I had a couple times prior to, very sweet nurse. She had just moved here from the Philippines. There was a bit of a language barrier. I've had her as my nurse before, but nothing really complicated, just simple things. And so the nurse says to me, I'll get you some Tylenol and Maalox. So she leaves the room. She comes back a few minutes later, and I'm lying on the hospital bed, and she comes over and she has these 2 syringes. And so at the time, I had an NG tube with a drainage in my nose. So if anyone doesn't know what that is, it's like a tube that goes down to your stomach. And if you need like food or medications given to you, they could put it down that way, right? But I had no problem swallowing. It was just trying to get the bile out of my stomach from the surgeries and stuff. And I do have a picture of that. It's horrid.
Oh, yum.
So if you want to see it, I can definitely send that to you.
Oh, yeah.
Anyways, so I had that going on. And then I had a central line here in my neck. And that was to administer medications and to take blood and stuff like that for me. And so the nurse moves over to my side, and I had no idea like what she was doing. I'm like moving my hair out of the way and tilting my head, and she pushes the first syringe in and
into the central line.
Well, I didn't know.
Oh, okay.
At that point.
Okay.
I didn't know what was supposed to be where at that point.
Okay. But you're assuming, in your head, you're going, I'm assuming this is going to my central line. Yeah. I'll make the room for my neck.
Well, even still, I mean, she's walking over here with syringes. That they've done that stuff before.
Yeah, you're just going, I'm going to make myself available. Yeah. Because you're putting something in me.
I didn't question anything.
And you probably know where it goes. Yeah. Since you're the nurse.
Exactly. Yeah. So she's a registered nurse. I just assumed, don't make assumptions because you just don't know. So she pushes the first one in. Everything seemed fine. She goes to push the second one in, and my whole chest just went, and I was like, oh, I don't feel very good.
Oh, God.
Within like seconds. And so I'm like, just kind of like trying to like reposition myself in the bed. So the nurse leaves the room for whatever reason. And I'm lying there and I'm like breathing stronger and heavier. And I'm trying to like sit, lie, stand. Nothing's working. And at this point, I start crying, which I'm not really a big crier. Maybe now that I've hit menopause, I'm a lot more of a crier. But anyways, so the charge nurse hears me crying out in the hallway. And she comes in. She's like, what's going on? Because they knew me well. And that wasn't a typical response for me. So she comes in, she's like, what's going on? So I'm unaware of really what's going on. And so I'm like, well, I had this really bad pain. I explained to her, and she says to me, it sounds like a really bad gas pain. I'm going to get you to stand up and try to walk around the bed. So I'm trying to do this, still crying. I'm collapsing because I'm in so much pain. I would have rather have given birth all day than experience the pain that I was like, I could hardly breathe. Like it was just unbearable. And anyways, so this nurse who comes into the room, she actually didn't work for the hospital. She was like outsourced.
Like a travel nurse.
Yeah, something along those lines. And so she sees this and goes back to the med room and then comes back in again. And so meanwhile, the charge nurse and I are trying to go around the bed. The nurse that I originally had these medications comes into the room, and I'm sitting down at the end of the bed, and I had this very small line. It's maybe like, I don't know, 3 inches long. And in front of the charge nurse, she attaches a syringe, and the charge nurse notices it's white in color and it's kind of a chalky color.
So she attaches the syringe to the line that is the central line
in my
which
neck,
goes in the neck to the heart.
And
exactly.
And the charge nurse notices what the contents of the syringe looks like.
It looks strange, right? So I don't know why she did this, but she whispered, "What are you doing? We don't do that." And then the nurse that gave me the injection went, "Oh, okay." She disconnected the syringe and she left the room. And it took me a second because I'm still crying through it, all of this. And I say, "Wait a minute. What do you mean don't do that?" I said, "She already did." And then I started panicking because I'm like, what the hell did you just do to my transplant? Like, am I going to be okay? And then I'm like, I told my kids I was going to be okay. Like, I'm frantic at this point.
Out, yeah.
And so the charge nurse is like, she left the room for a second, came right back in. She brought another nurse in with me while she said she was going to get a doctor. Okay, so that's fine. So the doctor comes, and I'm in a ward at this point because when you get a kidney transplant, they like you to be around other people so that there's always a nurse kind of coming in and out. Mm-hmm. So if something's going on, they're going to know, right? And so it was just me and another person, I think, in the room. And anyway, so the doctor comes in, he peeks his head through the curtains.
He goes, "Peekaboo."
Yeah. He doesn't check me.
This whole story is making me feel so anxious.
I know. It's kind of like a horror movie.
Yeah. Oh, well, it's a long story. Like this could be a couple podcasts, guys. Like honestly. So the doctor's like, didn't check me over, didn't ask me any questions. Yeah, you can give her something stronger for pain, he said. So what did they do all night? They shot me up with sub-Q shots of 4 to 6 milligrams of Dialysis. I'm not a really big girl, but wow, I was a mess.
You must have been itchy.
But they haven't told you, like, they haven't told you.
Still haven't figured out what this,
but you know something is wrong.
Mm-hmm.
Yeah.
So I tell the charge nurse that, what do you mean? She already did this. So anyways, they give me this Dialysis sub-Q shot, and it goes right into my muscular system. So I'm already a mess. And the last thing I remember saying to her was, "Can you call my dad?" And so I woke up at like 2 a.m. and my dad was putting like cold face cloths, like compresses on my face. And I kind of woke up talking to myself for a while there. I thought there was a chair across the room and I had a full-on conversation with someone. Anyway, I was really messed up. But anyways.
Was it Jesus?
No.
Was it Oprah?
I don't think so, but who knows? So, so everything seemed fine at that point. Like I'm assuming, okay, they did what they needed to do. I don't know. I'm drugged, but I'm not in the pain that I was in, right? And so I wake up in the morning, I'm by myself. I hear a nurse kind of coming in with like her little wheelie cart. And so the curtain gets pulled back, and it's one of my favorite nurses from dialysis who just happens to work on 6B occasionally. So she kind of goes back and forth. Anyway, she looked at me and she was like, "You look like absolute shit. Like what happened to you last night?" And I'm drooling on myself because I am literally out of it. And I'm like, I don't know. I had those injections last night. And she's like, "What injections?" So she takes my inpatient binder, goes to the front desk. And lo and behold, the charge nurse is starting her new shift. And so
same charge nurse from
the night before.
Right, yeah.
And she says to this nurse, "Oh," because my new shift morning nurse comes in and she's like, "What is Tracy talking about these injections?" And the charge nurse says, "Oh, Tracy knew what happened?" Well, I did know what happened. I told her I knew what happened. But that's okay. Anyways, nothing was documented. There were no notes. Nothing explained about what happened the night before. So when this new morning nurse came in, she was like, "I can't read anything about this because there's nothing documented." So she calls the transplant team. They call a merge. A merge calls a toxicologist, and they rush to me right away.
Whoa, dude, this is wild.
Yeah. Oh, there's a lot more to it.
This is wild.
Yeah. So, and it's crazy because over time, I kept meeting people that were like puzzle pieces that I had no idea even existed.
This is it's kind of a murder mystery.
Yeah.
It's a little bit of a who done it.
Yeah. Sort of
know
thing.
What I mean? Like a little bit of maybe a little bit of a someone and maybe
yeah.
You know what I mean? I mean, I'm not going to say
let's keep going.
Sounds like a
I'm invested in this story.
Yeah. So okay. So Toxicologist comes and sees me. She's putting the strip through. It's not working. So it's just my dad now and I in the step down unit. They move me back. Oh, before that, when this morning nurse came in and saw me, she was really concerned for me. So she's like, I'm going to put you in another private room. So she actually put me in a ward, like an empty ward. And so I'm like, okay, I'm drugged. I didn't really care what she had to say at that point. I just went along with it. And I woke up, before they put me in step down, I woke up to 7 different nurses all around my bed. Some were crying. And the morning nurse was like,
and
right
that
to my
wasn't a
side.
dream, right?
This is a real thing. This really happened.
Okay.
The only light that was coming in was from the doorway of like the hallway, right? And so I'm like, oh my God. Like, so I look at the morning nurse and I'm like, am I okay? Like, what's going on? Because I'm looking at some of the nurses like, this is freaking me out. Like, why are they all upset? And she's like, well, we're just going to put you back and step down because, you know, we're just going to keep an eye on you from what happened last night. And they just made it seem very nonchalant, like it wasn't that big of a deal.
Right.
So it's...
Which, like, granted, I mean, you know, to their defense a little bit.
Yes.
Like, the last thing you want to do, I mean, obviously you want, like, you should
calm.
know what's happening, but also it's like, because I don't even know what's happening.
Yes.
And I'm kind of like, please be calm.
Yeah.
Because I'm freaking out. So like they want to be calm, right? They want to make sure they're not going to go, well, we might have killed you.
Yeah.
So you got about 20. So we're going to put you at step down.
Well,
but, that's why we're all having a seance over top of it. Sermon.
Yeah, it's like, sorry, you weren't supposed to be awake right now. We were actually just going over with these new nurses exactly what you're not supposed to do because this one that's crying might have just killed you.
Yeah, because you're doomed. Yeah. Okay, so they put you in the step down.
Yep. So my dad and I are there.
And you're still at this point going, I don't know what the is going on.
Yeah, well, my dad had no idea what happened.
Sure.
No one told him anything.
Yep.
And I mean, I was talking, but I'm sure, I don't know how much of it made sense at that point.
Yeah.
But the surgeon who did my transplant came to see me. He said, I'm really sorry, Mrs. Murphy, but we need to send you back to the OR. Your platelets are dropping below 16,000. Okay. So I'm bleeding to death.
Okay.
And this is where, so before you put that on, this is what happened. I go for surgery. My dad's the only one there. So he doesn't know how serious of a situation I'm actually in. And he says, he comes out and looks at my dad and he's like, I need you to call her family to potentially come say goodbye.
Oh.
He said,
at this point, do you know what the nurse put in and why it was bad?
Well, I knew it was Tylenol and Maalox because she told me, right?
Yes.
But I don't know anything else about it. I don't know
why that was wrong.
Yeah.
Right.
So I knew something was off. I just didn't know exactly what. And so the doctor comes out, tells my father to call my family to come say goodbye. And then he says to him, he compares me to a crack in the foundation of a concrete wall. He said, you can tell there's a crack, but it was literally coming from everywhere. I was bleeding to death.
Oh, wow.
And so this is where I ended up having drain packs surgically put in.
And so what we're seeing here is bags of blood.
And it's dark
being
blood.
Filled by a nurse or some sort of practitioner.
No, those bags are actually filled from me.
That's what I mean. Yeah. So like, it's like these bags are being filled from your body that is seeping blood out. Mm-hmm. And this video goes on for like a minute or so. But
well, the video kind of looks like
they're putting new bags on and like filling these bags.
It looks like an undercover video though.
Yeah.
Did you were you taking this like, holy I need to document this?
No, I just kind of recorded everything to know my progress along the way. Like I was never.
It does look like something out of like the Fifth Estate.
It does, yeah. It looks like you knew that there was something off about it. Like
I just recorded it to show like, I mean, I started taking pictures. As soon as I ended up on dialysis, I couldn't look at myself right away. I just felt this massive package on my neck and I didn't know like what to expect. So I just went like this with my pink pearl flip phone and took a picture. And
how many of those bags did you fill up there?
5.
Oh my goodness!
I had 5.
How many liters is that? It looks like
dude, that's like
a couple liters of
you
bag.
wouldn't believe
that's like half the blood you have in your body.
I mean, that's got to be at least a 500 milliliter, if not a liter bag.
Well, when I pulled my medical chart later on, I was like, "What are all these pages?" And it was blood transfusions. I've had anywhere from 25 to 50, and because every time I went for surgery, I would bleed to death like this. I would always need a blood transfusion and I would always need drain packs.
Okay, so do we know now what happened?
I know because of AI, not from the doctors.
You still haven't gotten word from the doctors or anything like that.
But you mean like from AI, like you put your records into?
No, I was going to do that for other reasons, but I just started looking up some of the things that happened to me, and it said this is what happens. So basically, what happened was the capillaries in your veins, they were bursting, right? Like the blood. What happened? Like your body naturally thickens your blood, right? Mm-hmm. But when this medication went in my system, it just caused it to like thin the blood.
Due to specifically the Tylenol and the Maalox that was fed into your direct line into your heart.
Yeah.
So, and does that have anything to do with the HSP? Because like your HSP, the Purpura part is your blood seeping out of your blood vessels.
Yes.
Right? That's why it looks like you're like you that's why the rash appears. So it's not like due to that.
So is it that your blood becomes too thin for your veins and things to
kind of like a warfarin or something, right? It's like
it's like a huge amount of warfarin going through your body. Right. And so they're using these blood packs to try to like collect the blood that's going everywhere. So after this happened, that I
fucking crazy, dude.
I came out of surgery.
Yeah.
And I was actually awake. So I'm being pushed down the hallway, and all I see is the morning nurse coming towards us from the elevator, and she has a bunch of my girlfriends with her, and they're all crying, including the nurse.
Yeah.
The hallway's filled with my siblings, my parents, my family members. Of course, my kids aren't there. They're very young at this point. My son was, he turned 2 the month after I started dialysis.
Right, okay.
And my daughter was 10 and my stepdaughter was only 13. So the kids were really young at this point. And so I looking at everyone and I'm like, why are you guys all crying? I'm fine. And like, obviously I'm drugged. Because at this point, I seen this big neon sign on the wall that was pink and it said YMCA on the wall. This is me hallucinating, right?
Oh, okay.
So I'm like, this is a really weird place for recovery.
Like, well, that's a weird thing to bring to someone.
I know, right? That's yeah. So
it's
I'm
her
like,
favorite song.
Yeah, exactly. Someone's gonna break out. Yeah, exactly. In a dance in the recovery room. So I'm in recovery. That's what I see on the wall. I don't remember much after that, except for waking up the next day.
Right.
Only to discover that the same thing is happening all over again.
Oh,
I'm bleeding to death. I have to go back to the OR. I had to have more drain packs put in, and my family once again was called in to say goodbye. And so, surprise, I survived it.
Yeah. Right. Oh, okay. Good.
And so
why does it? And I guess I mean maybe this isn't even a fair question to ask because it sounds like you don't fully know the answers, or at least haven't been told by anybody. But like it kept happening, and you kept. Based on your records, how many blood transfusions you had to get. But like, is this the result of like, your blood just thinned and like that is now the case, or at least it was for a certain amount of time that it would just keep spilling out of your veins?
Well, so after like all of this happened, we discovered that I had something now called Atypical HUS, which is extremely rare again. And it was something really traumatic has to happen to your body in order for this to activate. And so
what does the HUS stand for? Do you know?
No, I don't remember.
Atypical HUS.
Yeah. It's like helemic. They told me that I had TMA, which was just like fluid around the transplant.
Hemolytic uremic syndrome.
Right.
HUS.
So this is very rare. And the only thing for me, so basically what happened was when I got in my perspective, this is all from my perspective of things, because it has not been proven in a court of law or anything like that of that nature. But when I had the Tylenol Maalox injected into my bloodstream, it activated this genetic blood disorder. And every time I went for surgery after this, I would bleed to death. So every single surgery I had to have all these crazy things happen.
Why?
And are they prepared for that now? Like,
they were.
Yeah.
Every time I went for surgery, they would automatically have, a hematologist on hand and the proper staffing to make sure everything was good. And so after I bled to death that day, well, I didn't bleed to death. I almost bled to death. I had more drain packs put in. And so that was fine. But like a couple weeks later, this is where the pictures come in, where those are abscess that you'll see here in a second.
So I have some more photos here, which these make me really uncomfortable.
So I ended up, within a 4-day period, I went from 118 pounds to 181 pounds.
This is so gnarly.
That's abscessed, and I had 2 of them.
So what we're looking at for folks just listening is a photo of what is this? Your belly?
That's my stomach.
Okay, yep. So it literally, like, no hyperbole, literally, go throw on Alien. 1970,
yes.
1979, 1977 Alien. The chest buster scene right before that alien busts out. It's gone through the rib cage and it's about to just bust through the skin. That is literally what this looks like. You can even see its little head almost.
That was a different that was a different abscess. This is edema.
Okay.
So I know that looks like my butt, but it's not.
Yeah. What is it?
So
that's my back.
Yeah, so this is the back, and she's sitting on her butt. So the bottom of the bed is where her butt is. She's sitting. And this would be like the hip crease, right? But there's so much swelling in the edema that it really does look like a bum.
I know.
Wait, I'm so confused.
Oh, so like your bum.
That's my butt.
That's her butt.
Your butt is here. Your leg is here.
Yes, exactly.
And this is your back.
Yes.
And there's just like so much edema here that it's swelling. Yeah.
If you were like a overweight person,
mm-hmm.
you would probably be what your side looks like.
Yeah.
Yeah.
But
yes,
my brain is having a super tough time putting
I know
this together. It's like when you see the armpit.
It's right here, Tay.
It's like when you see the armpit thing, and it looks like it's the curve of someone's ass, and then you tell them, but like it's
like love handles.
Yeah,
we're looking at.
Yep.
But this is thicker, and that's creating the butt.
Yeah.
Okay.
So I went from 118 to 181 pounds in like a 3 to 4 day period.
From what was that? Swelling, edema.
Yeah.
118 to 181.
Whoa, that is a
65 pounds.
Major quick swing.
Sounds like me when I started creatine.
Yeah.
Dude, fill up.
Yeah. But steroids actually can't do that to you right away. You can't gain, because I thought, so after I had this Tylenol Maalox injection and they put me back in step down, they injected me with, on purpose, that they gave me, sorry, I shouldn't say inject. They gave me 750 milligrams of steroids in an IV. And so I assumed that it was the steroids that did that, but it wasn't. Mm-hmm. I later did come to find out that, in my opinion, it's the Maalox that caused that to happen.
Man, crazy. So, I mean, we're coming up to time, and I know that, like, I mean, you gotta.
We got a lot of story left.
Yeah. And which, like, you should start your own podcast. You really should.
Well, I do have a podcast starting.
It's shortly coming out.
Yes.
The Optimistic Kidney.
Yeah.
But we didn't even get to the second.
Yeah, I know. Transplant. And so, the second transplant is wild. But the one thing I want to say before we like just get to, and kind of focus on the wild part, at least the wild part I know about the second transplant, is the second transplant. Was that in any way a requirement due to the fact that all this shit happened with?
So they end up taking the kidney out because I was too sick.
Just took it right out.
They had to.
So and then hence you were on dialysis for a number of years.
13 years after.
Yeah. 13 years.
12.
12 years of dialysis.
Mm-hmm. I did a year before that, and I was going 5 days a week because when you're smaller framed and you're younger, because I was only 30, it's really hard on your body. So I would do 5 days a week of 2.5 hours of dialysis at a time.
Oh my God.
And that was my life. So I couldn't do anything else. And I had to play around with the machine to figure out what worked for me in order to know how I could still function, because it was a challenge, big time. Mm-hmm.
Wow, crazy. So the next transplant you end up having was so this was 2011, the first one. The second one was 2022.
Mm-hmm.
Okay, so we said it was crazy that your donor was your stepmom from the first one. That's peanuts compared to your second donor,
right?
Who was Oprah. It's no, that would be nuts. But it's up there. It was your husband.
Yeah, he ended up being a perfect match. They said he was a perfect candidate.
Is that not bananas?
That
is bananas. That's one of the,
Can I just ask you why was the first one such a short amount of time and then the second one so long, especially given the fact that your husband ended up being
so it ended up being there's a lot of reasons. For one, it was something that they just didn't want to talk to me about afterwards. And so I was left kind of like, okay, no one sat down with me and talked about, hey, you shouldn't have Maalox and Tylenol injected into your body, and here's why. Or here's the things that went wrong, or, but this is what we're doing to fix it. There was just no conversation ever. And so that was very stressful. And because here's a kicker, in Nova Scotia and in Canada, there's no law at all stating that they have to tell you when a medical error has taken place. And it's because we, as a country, we follow the monarchy. And this was developed back in 1890, maybe, I think, where we are a country that supports the doctors more than the patients. And that's why in the States, they are more so focused on the patient than the doctors. And so that was a big thing.
Unless
just not when it comes to pricing.
Unless you're looking at the way that they have to pay for their healthcare. And they're going, well, you don't have the money.
Yeah.
So interesting. So there's a little bit of there's a lot or a lot of sort of going on in terms of maybe perhaps someone might say, I don't know who, but maybe saying sweeping some stuff under the rug in order to protect. There's so much more to the story, which is crazy. But the atypical HUS ended up being a major issue for me. This drug I needed to get in order to get another kidney. It was $3 million a year. Oh, wow. Oh, that makes Trikafta look like it
does.
What was $3 million a year?
The drug I needed. So this atypical HUS that was activated from this genetic blood disorder. There's a long story about that drug too, which is crazy. But anyways, it took me 7 years to get approved for it. I had to actually 100% prove that I actually did have atypical HUS. And so I was constantly flying back and forth from Halifax to Toronto. And I did have to go to Toronto and get a hematologist to say, yes, you do actually have atypical HUS. And then as soon as I got that approval, that was February 28th, 2000. No, not 2000, 2020. That's when COVID happened.
Right.
So March 5th, everything shut down.
Oh, God.
And so did the Toronto General Hospital. And so that's where I was actually going to get my kidney originally. Because they were like, I called them. I actually sent a referral myself to the Toronto General Hospital and said, hey, I really need a transplant. Can you help me out here? And they were like, you can get one in Halifax, right? And I was like, long story. I told them the story. They were willing to talk to me, but they said, hey, you can't send a referral yourself. You have to have a doctor send it. So I went to my family doctor, said, hey, can you send this referral? He did. And then sure enough, I flew back and forth to Toronto to try to get answers. And they were like, we see no reason at all why you can't have a kidney. And so that was from there. I just had to get approved for this atypical HUS. And then I got that. And then I got the drug approved. And anyway, I had one doctor who stood up and said, you know what, I'm going to help you get that kidney now. And so he did the paperwork. He did everything to make sure that this kidney transplant, I owe everything to him and to my husband and everyone for their part and what they played, because it was definitely a team effort of people that just were like, hey, this is not right. Let's fix this. And now I'm doing amazing.
I was going to say, so like the new, your husband's kidney working well.
Yeah.
Feels good.
Yeah.
Do you still have those 2 shit can kidneys hanging out in you?
Yes.
Wow, crazy.
They're still there.
Does your husband ever make jokes where he takes credit?
Yes. Yeah. Oh, yeah. Well, the doctors actually say that your golf game will improve if any donors out there. Your golf game will improve.
Because he's got more movement.
That's right.
Oh, sorry. I thought they said that to you because you have a man's kidney now.
No.
You're gonna get
less
a man
movement, less
man
space.
kidney. Your golf game's gonna improve later.
Yeah. No, it was not me. That was him.
Yeah.
Totally.
Your driving's gonna go through the roof. You're gonna be. It's everything.
They said that once when he got the kidney.
You're gonna be so privileged walking around here.
And he was like, hey, this is gonna improve your golf game.
Yeah.
And then the surgeon was like, it actually will improve your golf game as well if we just take one of your floating ribs.
Yeah.
Let's do a floating rib while we're at it.
Yeah.
And the kidney. and then you're going to get 12 degrees more rotation.
That's right. You
on
could
your
suck
drive.
your dick on the green. Right?
Because the floating room is gone.
That's it.
The Marilyn Manson.
So the whole plan,
can twist and bend way better.
All of this, even though the story is like really crazy and there's so much more to it. The whole point is I learned a lot from what I experienced.
Yeah, I bet.
And so I really want to help educate others from being or becoming their own advocate, because I learned how to become my own advocate from this. And so I did help prevent 8 life-threatening errors from happening just by asking simple questions. Like I was in Emerge one day and I told the doctor I was allergic to codeine with or Tylenol and codeine. And so she's like, okay, we're going to get you some medication right away, because I had a migraine, but I thought I was having a stroke. So big difference, but same kind of symptoms, which was weird. And so the nurse comes in, she hands me this little paper cup, and I'm like, oh, thank you. I'm like, what is this? Just before I go to take it, she goes, oh, it's Tylenol and codeine. And I'm like, my stepmother stepped up and she was like, she just told you she's allergic to codeine. And the last time I had taken it, I had blacked out and threw up all over myself in the middle of the emergency department. So not something I wanted to repeat. And who knows what the next experience would be like.
Yeah.
But
I think I'm allergic. I think I have an allergy to Zambuca.
Oh, yeah.
Because last time I drank it, I blacked out all over myself.
Me too. Emergency department.
Yeah.
Me too.
Yeah. So just so much. So
and who knows
anybody
what
work in the ER,
next
when I come in there, don't be giving me any Zambuca.
Yeah.
I do just want to echo your point too, because I mean, it is so important. And there's so many cliche phrases that you could say, like knowledge is power and blah, 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 blah.
It's true.
But like the
Oprah
reason
said
why
that.
they're cliches because they are true. And you know, we know from the books that we read, like the monk who sold his Ferrari and those types of things, that I mean, these things are true. Knowledge is power. And you should be curious and ask these questions and double check things, because, you know, working in a hospital is really tough. It's they're long shifts. It's incredibly busy. There's so many.
You're the
patients
only
that they're
one
seeing.
focused on just you.
Exactly.
Yes,
and
absolutely.
so if anybody if anybody takes anything away from this conversation, it's exactly that point that you're making is you need to be your own advocate, and you need to ask these questions and prioritize your health first, because
absolutely
you can't expect everybody else to prioritize you as well.
Exactly.
And everybody else is juggling like a ton of stuff.
Yeah.
Right.
You are the only one sitting there thinking exclusively about what you're going through and like how
and
you're
until your
get to the other
doctor
side.
or your nurse is an AI robot, humans make mistakes. AI does not.
Oh my gosh. You'll
AI
never
makes no
get
mistakes.
rid of human error. It's inevitable,
Mhm.
right?
Yeah.
And so it's the point the hospital is missing is they're missing the patient part. It's like trying to keep up a stool, and like the doctors are there and the nurses, and then you have the hospital, but it's tipping because we're the part that they need in order to answer questions quicker, solve, puzzles like, okay, what's actually happening? How does this actually feel? What are your symptoms? People don't know how to really describe like how they're feeling or where it is.
Mhm.
So they just need to get more.
Develop that vocabulary.
Yes, exactly.
Yeah. And develop that curiosity too in yourself. Yeah.
So it's a matter of just like working. Like I don't have no ill feelings towards the hospital. I really want to work with the hospital, and so that we can prevent a lot of these things from happening, because it's been extremely traumatic. And like I've developed a really bad case of PTSD from all of this. And so there's a lot. There's like a whole other side of things when it comes to medical errors that need to be addressed.
Yeah, I know you said that you're writing a book too, and so there's obviously a lot that we didn't get to cover today, and I know that personally I'm really interested in reading more about that and hearing more about that story, because I think it is a really important one to share.
So the podcast actually will be out in the next like 2 or 3 weeks. It is called The Optimistic Kidney, and my book will be out hopefully in the next 6 months, and it's called Ask Questions, Your Life Depends on It. And it's just sharing my own experiences and how I learned the hard way to become an advocate for myself. And by learning how to ask like proper questions, I was able to uncover so much. And it actually helps the staff because it prevents them from, a malpractice case happening, doctors and nurses getting in trouble. Like that's not the plan. I don't foresee staff members going out and like becoming a doctor or a nurse, for example, to hurt people. Like I think they really go into it with the right intention, and then things happen sometimes that are out of your control, but there's also times where it's a matter of maybe needing to educate yourself and know that, maybe it's not a great idea to put Tylenol and Maalox, and it's crushed Tylenol.
Yeah, right.
So it was 650 milligrams of oral Tylenol crushed, mixed with water, which doesn't have the same pH balance.
No, you're supposed to snort that.
Oh, Jesus. Yeah.
Right?
Or cook it on a spoon.
And Maalox, I was told never had happened to anyone before. But we did find one case of a patient who had Maalox injected into their bloodstream. They were in Japan, so the whole thing is in Japanese. And so it was really hard to figure out exactly what happened. But there are ways around that now because of AI. And so I did actually find 4 other patients who had passed away instantly from having Maalox injected into their bloodstream. So it's just, I really have to count my blessings because, I almost died a ton of times. Yeah. I've never seen the light though, the tunnel. It's never been there. So I'm like, that's maybe a sign that I'm not ready to go yet. So, but yeah.
Man, wild. I mean, for folks that are curious, and want to follow the podcast, want to get their hands on this book, how can people follow you and find you?
So I am on Facebook, although I'm not very tech savvy. So I have to get someone to start following along with these things. But I do have The Optimistic Kidney is on Facebook. And I do have this podcast starting very shortly. So they can look me up that way as well. Cool. And like I said, the podcast should be up and running. And it will be recorded like a video like this and on Spotify and everything.
Well, Sweet. Tracy, wild story. I'm so glad that you're still alive.
Thank you. Me too.
and kudos to you for doing the good work and spreading this word and advocating so strongly for yourself and others.
Thank you.
This has been really fun.
Yeah, I agree. Actually, it's been a great experience for sure.
Great.